Northwestern Memorial Hospital has about 200 gunshot wound victims a year. Dr. Marie Crandall remembers one patient in particular.
We had a 17-year-old come in shot in the chest, and he did okay. We put a chest tube in, he was released in 3 or 4 days, he did okay. 2 weeks later, he came in shot in the spine, and now he's paralyzed from the neck down.
The boy was shot by the same people who shot him the first time.
And the reason why he was shot again was because the people who shot him the first time were afraid that he was going to tattle. He was going to snitch and testify.
Cases like this one motivated Dr. Crandall to start a partnership with the anti-violence program Ceasefire. When a patient comes in with a gun wound, the hospital contacts a ceasefire responder.
We call them immediately. It's almost like we are calling radiology.
Ceasefire steps in right away to calm the situation and keep patients from ending up back in the hospital.
They're also on their phones talking to people on the street to, like I said, decrease the likelihood of people who are very energized with this kind of situation, to decrease the likelihood of retaliation.
Levon Stone Sr. oversees the hospital partnerships and was a responder for 5 years.
Not concerned about who did it. We just want to know the details of, do we think he's going to be threatened, or the family is going to be threatened, or is it going to be a possible retaliation from him or his friends? So we're basically trying to prevent this from being an ongoing situation.
I think she probably would have emailed me if you didn't.
Sheila Reagan started the partnership with Dr. Crandall, who she says has been a huge influence on many levels.
She has a strong voice from her role as a researcher, as a practitioner, as a leader in the healthcare universe, but she really does emphasize that the right people need to be doing the work at the right time.
After a ceasefire responder speaks with a patient in the hospital, their information is relayed to a case manager who continues to work with the victim to prevent further violence from happening.
Dr. Crandall hasn't forgotten about the young boy who was paralyzed.
Not a day goes by that I don't think that if we had had ceasefire in place, that they would have been able to easily discover who the shooters were and say, this kid is not going to tell.
But she knows now she can help others avoid a similar fate. Colette Luke, Medill reports.